Hello students, welcome back to my channel. So you're watching Sandhya OBG Study Point. So in the previous video, as we discussed the word antepartum hemorrhage, so in today's video we will discuss about the causes of antepartum hemorrhage, that is placenta previa. Okay, so we are going to discuss what placenta previa today in this video. So first of all, let's see what is placenta previa. So as you can see in this picture, as this is the placenta over here, this is the placental implantation, and the placenta is implanted in the upper segment of the uterus, that is normal placenta implantation. Okay, but in the condition of placenta previa, as you can see here, the placenta is implanted in the lower segment of the uterus. So this is the condition we are going to discuss on. So let's get started. So first of all, let's see the definition of placenta previa. So in the definition, placenta previa is a problem during pregnancy when the placenta completely or partially covers the opening of the uterus or cervix, we can say. Okay, because the cervix is nothing but the end of the uterus, or we can say the neck of the uterus. Okay, the placenta is an organ that develops inside the uterus during pregnancy. Okay, so the thing is, when the placenta is getting implanted in the lower segment of the uterus, then this condition is called placenta previa. There are many reasons and many types of placenta previa we will discuss further. Before that, let's see the incidence report. In 80% cases, it is found in multiparous women. The incidence is increased beyond the age of 35 with high birth order pregnancies and in multiple pregnancies. The incidences are approximately 4 to 5 per 1,000 pregnancies. Now let's see the risk factors. What are the risk factors which can lead to this condition? Multiparity, of course. If the mother has already given birth to the child, the elasticity of the uterus will be affected. So there may be any kind of an abnormality while implantation of the placenta in the uterus. Okay. Next is increased maternal age. Of course, if the maternal age is more than 35 years, then in that condition also, this condition may happen. Next is higher altitude. History of previous scar in the uterus. Of course, if the mother has already gone under a cesarean section previously, then this condition may lead. Smoking, another factor. Okay, so these are all the risk factors of placenta previa. Now moving to the types of the placenta previa. So there are specifically 4 different types of placenta previa. So first one is type 1, low lying or low implantation, when the placenta attaches low in the uterus. So as you can see in this picture, the placenta is implanted in the lower segment of the uterus, not in the upper segment. So this condition will be called as low lying placenta previa. Okay, but it is not covering the opening of the cervix. The cervical opening is not covered by the placenta. So this condition is called low lying placenta. Okay, low lying placenta previa. Okay, just because the placenta is in the low lying, but it's not covering the opening at all. Okay, so now moving to the next type, that is type 2, marginal placenta previa. This placenta previa is near the cervix opening but not covering it. It means, as you can see in this picture, at the margin. Okay, marginal placenta previa, what is it? When the placenta is implanted, of course, in the lower segment of the uterus only, but at the edge, or we can say at the margin of the opening of the cervix, that like this. So as you can see in this picture, the placenta is implanted in the lower segment but at the edge of the opening, cervical opening. Okay, so this is marginal placenta previa. Now moving to the next type, that is type 3, partial placenta previa. This condition is when the placenta is partially covering the cervix. As you can see in this one, partial placenta previa, when the placenta is partially covering the cervical opening, then this condition is partial placenta previa. Moving to the next type, that is type 4, complete placenta previa. It occurs when the placenta is completely covering the cervix. Okay, so as you can see in this picture, This is the implantation of the placenta, and in this picture the placenta is fully covering the cervical opening. This is the cervical opening, and this opening is fully covered by the placenta in the lower segment of the uterus. So this is complete placenta previa. So like this, there are specifically 4 types of placenta previa: low-lying placenta previa, marginal placenta previa, partial placenta previa, and complete placenta previa. Okay, so these are all the types of the placenta previa. Let's see the clinical features of placenta previa. What are all the symptoms we can find if the mother is in this condition? The symptoms: vaginal bleeding may occur. Okay, sudden in onset painless revealed bleeding, fresh blood, bright red or dark colored blood may be seen. Next is unrelated to activity. Maybe if the mother is not doing anything, still there is a bleeding inside. So this may be the condition also. So we have covered the symptoms. Now moving to the signs of the placenta previa. General condition and anemia are proportionate to the visual blood loss. Of course, if the bleeding is there, then anemia will take place, and due to anemia condition, the general condition will be affected. Next is abdominal examination. In the abdominal examination, we can see the size of the uterus is not as per the gestational age. Okay. Next is uterus feels relaxed and soft. The head is floating in contrast to the period of the gestation. Fetal heart sound is usually present because there won't be any harm to the fetus. Vaginal inspection, placenta is felt on the lower segment. Of course, if we do PV examination, so in that condition we can feel the placenta on a fingertip. Okay, so these are all the signs of the placenta previa. Now moving to the maternal complications. What are all the maternal complications due to this condition? During pregnancy, antepartum hemorrhage may occur, of course. Presentation of the baby won't be normal. Next is premature labor. During labor, early rupture of membranes, cord prolapse, slow dilatation of the cervix. Ultimately, the cervical dilatation will be slow as compared to the normal implantation of the placenta. Intrapartum hemorrhage. Other than this, in the puerperal period, in the puerperium, it may lead to the postpartum hemorrhage. Retained placenta. Some of the parts of the placenta or conceptual products may remain inside the uterus. So in that condition, there may be postpartum hemorrhage, and then subinvolution. Next is fetal complication. Low birth weight, asphyxia, intrauterine death, IUD. Okay, so these are all the fetal complications. So now let's see how we can diagnose this condition. Placentography. How we can do this? By sonography only. Color Doppler flow study, magnetic resonance, vaginal examination. So these are all the diagnostic evaluations for this condition. So how we will manage this condition? So the management can be done on the basis of 5 different fields, on the basis of prevention, immediate management, expectant management, active management, and nursing management. So now let's see the active management of placenta previa. What are the indications? Bleeding occurs at or after 37 weeks of pregnancy. Patient is in labor. FSH absent. Gross fetal malformation and dead fetus. These are all some of the indications. So how we can manage this condition very actively? So in the active management, we can go with vaginal delivery or C-section or cesarean delivery. Okay, so if the placenta edge is within 2 centimeters from the internal os, in this case no internal examination is performed and cesarean section is considered as the best choice. Okay, now placenta edge is 2 to 3 centimeters away from the internal cervical os. In this condition, internal examination in OT, artificial rupture of membranes, ARM, with or without oxytocin, satisfactory progress of labor, bleeding continues and no labor initiation, vaginal delivery, cesarean section. Next is nursing management. In the nursing diagnosis, decreased cardiac output related to blood loss as manifested by increase in heart rate. Interventions: monitor vital signs, provide adequate rest, reposition client, encourage relaxation techniques, and elevate HV of the client. Next is ineffective tissue perfusion related to decrease in HV in the blood as manifested by dyspnea. Interventions are monitor vital signs, encourage a quiet and restful environment, encourage use of relaxation techniques, provide supplemental oxygen to the client as prescribed by the physician. Is deficient fluid volume related to blood loss as manifested by vital signs changes. Interventions are monitor vital signs, monitor FHR, initiate IV fluids as ordered by the physician, place the patient in the left lateral position. Next one is fear related to the outcome of the pregnancy as manifested by the facial expression of the mother. Interventions are assess fetal heart sound, allow the mother to share her feelings, answer the mother's questions honestly, include the mother in the planning of the care plan for both the mother and the baby. So these are all the nursing managements of placenta previa. So it was all about the placenta previa today in this video. I hope you would have understood this topic very well. So I'll see you in the next one. Till then, goodbye and take care. Bye bye.